Um, I guess in the meantime, maybe we could talk a little bit about what the coverage of Beth's experience. We could also probably talk about the issue about whether or not Beth is going to be thrown in jail for insurance fraud, which is not a thing. Um, I'd love to curtail those comments
Yep, let's talk about that.
immediately.
I think it's a good idea to talk about that up front. So while we wait for Beth to come back in, I'm Ellen Danick, your co-host, and I'm part of the volunteer team at DIAG, Democrats for an Informed Approach to Gender. As I think most people who are here in the space know, we are a group of Democrats who want to bring our party back to an evidence-based approach to gender ideology and the medical care or interventions that go along with that. Do you want to say a little bit about who you are, Voice of DIAG?
Yeah, I'm a public health professional, and um, I started DIAG with a couple other people because I'm like they are a lifelong Democrat and um, completely dismayed by what's happening with what used to be the Party of Science and is now the Party of Ideology, I guess. So, just working to try and build our our base so that we have some influence and can um, get gain some ground with our party and not only our legislators, but um, fellow Democrats who have been sadly and horrifically misinformed. So it's a big task because we don't quite know what's going to work with people. We do know what doesn't work, which is the facts. Um, the TED Talk does not work for some reason. So we're going to be working toward figuring out how we can reach our fellow Democrats to get them to see the reality of what's happening. So that's what DIAG is about: evidence-based care for all, and um, being able to have honest, rational discussions about what is a major medical scandal here. We know that people are being harmed. We know that this is not medical care. It's um, ideological care. For some clinicians, it is fear-based care, but it's not medical care. So it's a tall order, but we're here to try and um, lead the effort to reach our fellow Democrats. We just have to turn the party around and our friends, our neighbors, um, uh, our coworkers. So I'm a little worried that Beth is struggling to get
Yep, why don't I talk a little
in.
bit about the coverage of Beth's story while you try to get her admitted?
Yeah,
And if we can't get her in, we'll bring a couple of people up on stage and we'll talk about it.
yeah.
That's the thing about a Twitter space. This is definitely it's new and doesn't always work as expected. So Beth Bourne is a mom in Davis, California, who has a daughter who began transitioning at school without Beth's knowledge or consent. And she can talk more about that when she joins the space. But she spent several years really trying to make sure that her daughter's well being was protected and that she wasn't subject to medical interventions that could harm her fertility, create side effects, and potentially lead to a difficult path as an adult. And so as her daughter got older, some things happened that enabled her, and she can talk more about this when she joins, to take some action. And she decided to go undercover at Kaiser, her healthcare provider in California, as a gender dysphoric patient. So, as a woman in her early 50s, coming in for her annual exam, she presented as somebody non binary and then basically let the Kaiser health professionals lead the process for her. And what happened as a result of that is her story that she's going to share with us tonight. Um, my co host is working behind the scenes to get Beth on the call. And so I am going to invite just a couple of people to speak because I know there are people in the space who are aware of Beth's story and might think it was interesting to comment on. So coming up on the stage, we have Buck Angel. And Buck, thanks for
Oh,
joining our
Beth is
Twitter
back.
space. Oh,
Just so you know.
okay. Buck, thanks for being willing to step up. I'll ask you back up later. Thanks so much. I'm going to move you back down to listeners. Thanks.
Welcome, Beth.
Oh,
Yeah,
great.
not a problem. Um, all right, I'll leave it to you, Ellen and Beth. I'm
Thanks,
just here
Ellie.
for
Thanks,
commentary.
Ellie.
Thank you so much. Beth, welcome to the DIAG Twitter space. We're so glad you're here. We talked a little bit about the background of your story and who you are, but very, very briefly. So, why don't we start with I know you are a mom in Davis, California, who had the experience of your daughter starting to transition at school without your knowledge or consent. I shared that with everybody. Would you talk a little bit about how that was your introduction into the world of gender identity ideology?
So it was back in 2018, and my daughter, who's incredibly gifted and bright, quirky, creative, sensitive, she went through some trauma at the end of sixth grade, and then was introduced to a lot of this LGBTQ um, ideas in school, and because of I think of the trauma and some of the other things she was going through. Uh, Sort of glommed onto this idea. And then during a wellness visit at Kaiser, when she was only 13 years old and had some dizziness, there was a substitute pediatrician that overheard her father using he, him pronouns. And the pediatrician immediately jumped on the idea and asked my daughter if we could change her records right there at Kaiser with the new pronouns and the new name, and then offered to send my daughter to and parents to One Stop Shop in Kaiser, Oakland, to the Gender Pride Clinic, which is a pediatric gender clinic in Oakland. And she said there my daughter could, visit with endocrinologists, OBGYNs, social workers. She said it was a one-stop shop, um, for gender affirming care, and that was in 2018.
When you heard that, Beth, when you heard gender affirming care and one stop shop, did you think that your daughter would be provided with therapy to talk about what was going on, or did you expect that she would be discussing medical transition right away? What were your expectations?
At that point, I'd already seen my daughter asked to cut her hair and change her clothing, but I didn't know very much about this medical side of gender affirming care. I just knew that I didn't want my daughter to even consider it. She had sent a letter to me, handwritten letter a few weeks earlier, saying that she had done some research and knew that WPATH and Planned Parenthood both had said that these puberty blockers and hormones were safe and reversible. So I didn't know it at the time, but that's kind of a script letter that these kids learn to write to their parents. This is my new name and pronouns, and this is where I'd like to go with it. But going back to Kaiser, when I heard them say gender affirming care, I was just livid. I was so angry at the pediatrician that she would even mention something medical to my daughter, even mention that she agreed that pronouns were a thing. So I called her up a few days later and I said, "How dare you bring up the idea of medicalizing a child, without asking permission from the parents separately?" And at that time, I didn't realize that what they've really done in medicine is tell kids, I think starting at 12, that you can have access to doctors without even having your parents in the room. That you can have Kaiser made my daughter's medical records all private. I think by the time she was 14, so I can't even access her medical records while she was a teenager.
Wow. And as your daughter ended up going on through this process. Tell us all a little bit about what that was like for her and for you.
Well, I think I got very lucky right about this time in 2018. There wasn't very much online, but Jesse Singal had just put out that article in the Atlantic that talked about parents handling it differently. And it even mentioned that there was one set of parents who were very educated who decided to not do anything medical and that their child had detransitioned. So that one article that my child psychiatrist shared with me made a huge impact in my decision. Um, and so I was lucky that I was able to talk my psychiatrist, my daughter's psychiatrist, and her father, my ex-husband, into agreeing that my daughter could not medicalize until she was 18. So that gave us almost 5 years. Um, but um, it gave me a lot of time. But I was this is something that I think Sasha Yad and Stella O'Malley have said, that the arc of kids being in this trans identity is actually 5 to 9 years. And so when my daughter hit 17, that's when things started to get really scary because I knew she had only a year before she turned 18.
That makes a lot of sense. I imagine that was something that made you feel like you had a ticking clock.
Right. And that's when I went into this, undercover mode with Kaiser, because there was this ticking clock and I just said I have to do anything to expose what I believe is a medical scandal so my daughter can understand that there's no safeguards in place, that it's all, I believe, a make believe, diagnosis and make believe treatment. Um, and so that's what was my intentions of going undercover back in September of 2022.
Okay, good. Well, let's talk about that. So, your daughter had turned 17. You were thinking you had a limited amount of time to expose this industry and not just try to help safeguard your daughter, but also protect other kids and teenagers from this. And you got a letter from your doctor that started this whole process. So, why don't you talk about that a little bit?
So a few months earlier in May, my daughter had received a letter from Kaiser that was sent, to her email inviting her to a gender expression workshop. And what Kaiser was offering these teenagers, and this is during COVID, is that they could come on to a weekly Zoom call and they would learn how to socially transition. They would learn how to cut their hair, or grow their hair out if they were a boy and wear makeup. If they were a girl, they would learn the mannerisms. They would learn how to lower their voice pitch or raise it. They would learn how to do, they made it sound fun. Like, this is a workshop. We're going to be meeting with a makeup specialist, hair specialist, and we're going to help you do the social transition. And um, I didn't realize it, but there's a man who identifies as a trans woman who works for Kaiser as a chief doctor, and he's the one who designed this pilot program. But I was upset. Here Kaiser's inviting my daughter to a workshop to socially transition. And when I asked if I could attend the workshop, they said, no, only if you have your child there. And I just thought, wow, why won't Kaiser let me at least get a feel for what this workshop is about? So Libs of TikTok, she went ahead and wrote an article about this Kaiser gender expression workshop. So a few weeks later, I got the invitation for a cervical cancer screening, and it said any individual between the ages of 21 and 65 with a cervix needs to come in for their cervical cancer screening. And that just set me off. I was like already, just upset with Kaiser. And then for them to use the word individual with a cervix. And I asked my OBGYN, why are they doing this? I think it's insulting to women. And she said Kaiser wants to be inclusive of gender fluid and trans identified patients, or trans male patients. Anyways, I asked her to either change the wording or talk to her administrators, and she wrote back and just said, that kind of explanation. And that's when I decided to write to my OBGYN and said, on second thought, and this is 15 minutes after I got the email, please change my records to say that I'm non-binary and that I use they them pronouns, And the reasoning I gave her was that I like to I think I said play tennis, and I'm really, sporty and athletic. And then within, I think it was 45 minutes, I got a note from Kaiser, from the official, like, the head doctor, saying that my records had been changed, and they wanted to know, what they could do to help me with um my goals with, gender. So that kind of started it off.
Oh, wow. So let me just ask you, Beth, when you announced that you felt like you might be non-binary, did you explicitly ask for any medical treatment and say, and so I would like to obtain hormones or I would like to obtain surgery?
In that first letter, when I said I just was upset. So I said, please change my records for my pronouns and, my non-binary gender identity. And I said, and I would like to be referred for a prescription for testosterone. So I did put that in there. As a non-binary patient, I would like to get testosterone. And then that's right. The chief doctor said, "We will get the ball rolling." That's the term she used. We will get the ball rolling, to assist you. And it was, I've never had that kind of response from Kaiser for any other medical issue for myself or my kids, where I got a response within, an hour saying, "What can we do to help you?" you know.
That's really interesting because you hadn't received any sort of a diagnosis, correct? You had just made an assertion
Right.
that you felt a certain way.
Right. And I guess that's it, it kind of it made me realize, when they said to my daughter, when they heard her change her pronouns 5 years earlier, that just hearing, her father use he him was enough for them to consider her a transgender patient. It was like, that's all it takes, is changing your pronouns and saying, this is what I am. And so
Well,
yeah, it just was validating as an adult to do the same thing and get treated the same way. So
wow. And so what happened next? You asked for this referral and it was
right.
expedited very quickly. And then what happened?
So the first thing they did make me do was go in to get my blood drawn, and the primary care physician I met with, they just want to make sure you've been to a doctor at some point, just a wellness check. And her concern for me, this my primary care physician, was just that I wasn't up to date on my COVID vaccines. I think I'd had maybe the fourth or fifth booster, and so we were kind of arguing about that. But when I said to her, I really am coming in here because I want to make sure I can get my top surgery, um, I just thought that was interesting. Is that there's no concern about why I want to have a mastectomy done or why I want to go on testosterone. But her concern was about me being, late on my COVID booster. So, so that was shocking too. It maybe a 9-minute appointment, and she said I was good to go because I'm in good health once I got back my blood tests. So from
Okay.
there, then I think it was, I think the top surgery is the one. Kind of around the same time, I got approved for the top surgery and the hormones the same day.
And and is top surgery what the medical professionals referred to this procedure as rather than a mastectomy?
Yes, yes, everywhere it's top surgery and lower surgery. So um, that's just the terminology they use, and so you get used to using it too. And it sounds so much. They call it the fun stuff. The T and the top surgery. Um,
The fun stuff.
yes,
These are
yeah,
medical professionals saying that's the fun stuff to you.
yes, it's true.
Wow.
I think they feel like the mental health assessment part, asking all these questions is not fun for the patient. But when they can start talking about, all these options you're going to have for when you do your top surgery, how you're going to decide on what flatness or what, where you want to have your nipples placed or no nipples, and what kind of effect you're hoping from the testosterone, as far as, do you want more facial hair or deeper voice, or so it's like you're at a fancy restaurant and you're been given this menu and you get to pick from it, what it is you want to do to your body, and that it's all, fun and games, and not instead, you're basically destroying yourself.
Yeah. Okay,
So,
so you were offered this portfolio of fun stuff as options that sounds
Right.
almost like cosmetic surgery choices.
Right.
And did anyone ask you along the way, are you sure you're non-binary? Do you know why you might feel this way? Were there any things you said that might have been red flags to practitioners that they noticed and said, let's slow this process down?
I was very, very clear on every appointment that I had these 3 red flags in my life that I wanted to be sure that they knew about them, before they're prescribing these um, drugs and surgeries for me. So I did bring that up in the mental health assessment. And this was with a MFT therapist. And so I shared with her that I was concerned about the fact that I had been, sexually assaulted as a child. And I said, could that be concern for why maybe I'm so uncomfortable with my breasts is because, I was groped as a kid. And she said, uh, thank you for sharing that with me. That must be hard. When you come in to have meet with a surgeon, we can just put a little note in your records that you might be sensitive. So it's almost like, oh, we'll just work around that. But that's no concern. That's why you want your breast removed. So the second one was that I had a little bit of an eating disorder in college, and I mentioned that that I was a distance runner, and all the girls on the team had anorexia and bulimia, including myself. Is that maybe a reason why I don't like my female curvy body, and I want it to look more masculine? I don't want my breasts. And again, she said not to worry. And I knew that there was a huge correlation between um, teens and young people who say they're anorexic and then they take on a trans identity. The connection with body self hatred and distorted view of yourself, and
Yes,
just
and
wanting
all
to
these
know.
comorbidities of
Yes,
mental and behavioral health problems. You're aware of that, and so you were really trying to raise those red flags. Okay.
yes. And then the third one was just my mother, having some mental health issues in her 50s and being she was actually in an inpatient program for a few months with body dysmorphia. And so I just brought that up, that my mother had concerns that she had this growth that really didn't exist on her neck, lymph nodes. And the doctors, I said, they didn't operate on her and she ended up being fine. But, I said to the doctor, could that be the same case for me where I want to have my this top surgery and maybe I don't need it? And she sort of said, well, in your mother's case, there was nothing in the lymph nodes, but in your case, we know that you have chest tissue. So for you to want to have your chest tissue removed, that's real. So so it's almost like even bringing up red flags, they wanted to tell you don't worry about them. We can work around them, or no, they're not really red flags. So I just had this feeling like I don't know if there's a some kind of um, incentive program where they get scored better if they get more patients, but there was no way
Wow.
that they were ever going to not try their best to talk me into it. What she even said, if this testosterone, if you're at all concerned about it, we have these micro doses, and you can just test the waters by putting your toe into the water and see how it feels, and then just give it a try. And I've just never heard Kaiser talk about any medical treatment like that before, where they're like suggesting you just give it a try and see how it feels. That it just didn't feel like it was real, real science or real medical treatment. It's just it's a totally different ballpark. This gender medicine.
That does seem to be the theme of your undercover experience, is it doesn't seem like it's any other area of what we consider to be evidence-driven medical care for sure. Okay, so you were approved for testosterone, you were approved for top surgery, also known as mastectomy of healthy breast tissue, not chest tissue. What happened next?
So I was just curious. Like, can I go even further with this? Like, top surgery is really common now. There's multiple kids I see around Davis, high school, college age kids who've had top surgery, and same with the testosterone. But could I ask for a phalloplasty? Would there at least be some safeguarding there?
Can
So,
you talk about what a
oh,
phalloplasty is in case anyone on the space isn't familiar?
sure. I did what I would do is I would do a few hours of research right before I got on the call for the mental health assessment and the nurse coordinator, and then before I met with the surgeon for the top surgery. I didn't get too into details because it's so graphic and it's so horrific that it would give me nightmares at the when I would go to bed before the calls and after. But basically, a phalloplasty, and they would explain it to me on the call too. But it's you're deciding to create a fake penis for yourself, and in order to do that, they need to close up the vaginal opening. So I they said they would give me a total hysterectomy as well with a phalloplasty, and then they create a fake penis using skin from either your you choose. They say you have these two donor sites you can choose from, and they tell you about the pros and cons. So this the gender therapist said to me, if I choose my forearm, my phallus or my fake penis will be thinner because that skin tissue in your forearm, it doesn't have as much fatty tissue. But she said if I use my thigh, that skin, it's fleshier, and then I would end up with a thicker phallus or a thicker penis. So that was the choice for my for that surgery. Sorry. And then there's just some other choices you have to make between um, either wanting to be able to urinate standing up or to have penetrative sex. So there's this other choice that has to be made with a phalloplasty. You can't have both because of the way the surgery works. Um, so yeah, it doesn't even seem possible that could be a surgery that could be offered to me, to a young woman or a middle-aged woman going through a crisis, right? That they would create a
Hmm.
fake penis that has no function, and that you would lose your sexual function and risk incontinent, and then all these complications that come from it.
Hmm.
So you're just destroying a healthy part of your body. Hysterectomy that you don't need. I don't know much about them, but I have a feeling that it would really affect your whole system.
Yeah, that organ does a lot more than just hang out and potentially carry fetuses. Okay, so you got approved for the phalloplasty?
I did, and that's the really shocking part about the approval that I got, is that when I first asked for it, I said, I'd like to go ahead and have the phalloplasty as soon as possible because I want my, top half to match my bottom half. So if I have the top surgery, I want the lower surgery at the same time. And I said, and I don't really want to be on this testosterone because, I'm just concerned about it taking off, 5 to 10 years off of my lifespan. I don't really need this facial hair to be non-binary. That's the beauty of saying you're non-binary because you can anything could make sense if you say you're non-binary. So,
Yep.
when I said, "Can I go ahead and skip the testosterone?" She said, "Well, we typically require 11 months um, of testosterone use for our patients before they can get top surgery." There was like this 11-month bar. She said, "But let me see if we can make an exception for you. I'll be in touch." And a few days later, she said, "Great news." This is an email that I can share, but great news. We heard from our multi-specialty team in San Francisco at the Kaiser in San Francisco, and you've been given an exception, and we'll go ahead and give you this referral for your phalloplasty. So that was just 4 months later from me even identifying. That's from the top surgery. So yeah, it'd been like 200 days in total from the time I told my doctor that I was non-binary to being approved for a phalloplasty.
So basically you were fast tracked. It was like they let you behind the velvet rope
Right.
to
Yes.
you're special. You got an exception and now you
Yeah.
can have a mastectomy, a
Right.
hysterectomy, a phalloplasty and have this non-functional sexual
Yeah.
organ and you're going to lose a good deal of tissue that will never be repaired on your arm or your leg. Is that about the
Yeah.
size of it?
Yeah, and I would hear things like for the top surgery, I said, "Well, how long will it be until I can get in to see the surgeon?" And they said, "We're experiencing a little bit of delay, but just know that we've hired 4 new plastic surgeons," and that's what she called them. "We've hired 4 new plastic surgeons in Sacramento to keep up with the demand for top surgery because there's such a demand." So they've hired 4 new plastic surgeons. And then she said, "The plastic surgeons really like doing the top surgery because unlike doing a surgery for a breast cancer patient, they don't have to worry about getting out, the cancerous tissue. So it's just a much easier incision, and they don't have to worry about the implants." So after I got the approval, I was on a list for cancellations. I got called in 2 weeks after meeting with the surgeon. This is all over Zoom too. None of this is in person. As for the top surgery, all your appointments are on Zoom. I
Okay.
just raised up my shirt to show my surgeon what I look like, without my bra on, so she could see. Um, but it's like a money maker for Kaiser because a plastic surgeon or the surgeon who does mastectomies for a woman who has breast cancer, they have to be very careful that
Hmm.
that they're doing it correctly. But for top surgery, it's all cosmetic, and so it's just an easier surgery. Um,
That's the first time I have, because I followed your story. That's the first time I've heard that particular bit of information about how they shared with you that the surgeons really enjoy doing
right.
mastectomies on healthy breast tissue because it's so much easier. I'm just trying to
Right.
think about what it would be like to be told that as a patient.
And it was the same for the phalloplasty too. When they said, it's a few months to get in with the surgeon. There's only one surgeon in Northern California who does phalloplasty for Kaiser, but he really enjoys doing the surgeries. It's a surgery he enjoys doing, and that just made me sad. Like, here I am going to be giving up my healthy body because this plastic surgeon likes to perform this, very complicated and very you know likelihood of risks, that I would just be giving my body up for that.
Yeah. So you're progressing through, you're on the fast track to testosterone and these surgeries. I think you may have mentioned that you were invited to some group workshops with other patients. Can you talk about when that happened and what that was like? Because I've never heard about that for medically necessary care, at least in my experience.
Right. And I did go back, and Kaiser has research reports where the Kaiser doctors actually do like more like academic publications or research journals, and you can see there's a research journal on these workshops, and I forget the the more scientific name they use for it, but Kaiser said they found greater success or outcomes with these workshops because they let the patient know in advance, hear from recent people that have had the procedure. So for both the top surgery and the lower surgery, after you meet with the mental health assessment and they give you the green flag, then you go on to a workshop, and it's about 2 hours long. For the top surgery, there might have been maybe 60 other uh, candidates for the top surgery. And then there was a panel of 3 recent young women who had had top surgery. And they just shared their story about, what they did to get ready and how they made sure they had meals lined up and someone to watch after their pet. And then they talked about, what kind of top surgery they wanted. If they, the incision, there's all these different kinds of top surgeries you can get, but it's kind of showing off like what you did, what you picked out, what your recovery was like. And what it was so interesting was of the 50 or 60 of us on this top surgery call, there were some young girls, probably 15, 16 years old. They had their mothers with them, in their kitchen, joining in on this workshop. But there are also a lot of women my age or older, and that shocked me. But it makes sense. You get this special treatment, and you get to feel important. And they promise you that your life is going to change once you have this top surgery, because you're going to be affirming this identity you've had all along that's made you unhappy. Having to live as a woman, and now you get to change your sex and become this new person. So
Yeah, you're no longer just a menopausal or perimenopausal woman
right.
seeking medically necessary care. Now you're a special star. So the women who had had the surgery who were on these workshop calls, how far out were they from their procedures? Were these women who had had surgery 5, 10 years ago who could talk to you about
Uh,
what to expect as you aged?
no, I think these women, it must have been within the 6 months or a year. They, the way they were, they gave the dates out, but I just remember it was within like 6 months or a year. And what's interesting too for this top surgery workshop was that the surgeon, who sort of gives like a 15-minute overview on how the surgery works, his name is Winnie Tong, and he is a plastic surgeon with Kaiser, and he identifies as a trans woman. So, you have a transgender surgeon talking to a room full, or a Zoom room full of patients who want to change their sex. But I, I just thought that was interesting that you have these trans identified doctors who are trying to get our kids or young people to also want to transition.
It sounds, I mean, I'm being a little facetious here, but it sounds almost like a sales pitch for a timeshare, Beth.
Yes, yes, it's the way they that they entice you to hear more about it, and so you kind of become invested in it. You do the appointments, and they send you these presentation slides to look at, and they ask you, what is it you're hoping to do, and you can fill out this chart that has your goals and what you're hoping the outcome will be. And then they send you to this class where you hear from recent patients that have had the surgery. I think they're trying to make sure that you don't back out at any point, right? Now you've invested all this time, you've seen these other people that have done it. Why won't you be courageous and brave, and also, drink the Kool-Aid, or what? I don't know.
Yeah, well, and you've been put in a position with a
Yeah,
group where you've identified in as part of, and so if you all of a sudden back out, now there's an extra layer of friction to prevent you from backing out in a way.
that's right.
Yeah.
Yeah,
All
and
right, so go
oh,
ahead.
I just one more thing too was interesting on this top surgery one is that when she was describing how much uh, gender euphoria she had after doing her top surgery, she mentioned that she'd also had a hysterectomy done, and this was a young woman, maybe, I don't know, 25, and that she also had that same feelings of elation after doing her hysterectomy. Um, so and so then you're wondering, is it just the idea, if I keep getting more surgeries, I'll keep getting the satisfaction? And one of the things that they brought up to me is that I can also, Kaiser would also provide body contouring um, for just a
Oh
hundred
yeah,
dollars.
let's talk about that.
Right.
Talk about the body contouring because I was not familiar with that.
Yeah. So on the, when I went in for my top surgery mental health assessment, she started off the call by saying, in addition to top surgery, I want you to know that Kaiser also offers some other procedures. We have the body contouring, and then she mentioned, the lower surgery. This is at my first visit. Um, but the body contouring, I said, oh, I might be interested in that. That's where they kind of move around, I guess, fattier parts of a woman's body to look more masculine. So I don't know if it's removing like parts of your hip or your tummy, but it's to give you a more male look. Um, but for men, a lot of times they want the feminization facial surgeries where they have their Adam's apple shaved, and maybe their
Hmm.
um, jaw not look so or their nose not look so masculine. But for women, it's more of your hips and your tummy.
So once again, you're talking about cosmetic, what sound like cosmetic procedures, and it sounds like a lot of these discussions were focused on what cosmetic procedures do you want, what do you want to look like, not is this a good idea for you to pursue.
Right, right. It's so little of the discussion is about the harmful, health effects. It's much more of of you know, is this your does this meet with your goals of what you want to look like? If you take testosterone, is it because you want to have, um, facial hair, and are you okay with the baldness part of it, or it's just like all these trade offs. Same with the top surgery. If we give you a really flat chest, we're gonna have to use tattoos to make nipples on your body, because you can't have uh, real nipples and a really flat chest. It's one or the other. There's all these trade-offs you're making all along in this surgeries, and none of the surgeries are necessary. So it's all, to me, was just making my head spin.
Yeah, and it sounds like the trade-offs discussed were not, if you pursue this, you are looking at the risk of,
Oh,
medical
exactly,
complications from
exactly.
unnecessary
No, yeah,
surgery.
the trade-offs are not the true trade-offs, right? They never mention, oh, if you take off your breast, you're never going to have the same kind of, sexual relationships with somebody because you're missing a part of your body, or you might, feel like, um that phantom limb, where you've had something amputated off your body. None of the real, like, risk are ever talked about. It's these superficial things of, like, scarring. So,
Yeah, that is a big part of what makes your story so interesting, because you have this firsthand experience of a medical organization that so frequently, like so many other medical institutions that provide quote unquote gender affirming care, claiming that they have safeguards in place and they have safety checks. But that was not your experience at all over a long period of time and multiple points of contact with Kaiser.
correct. Yeah.
Okay. All right. So you've been approved for top surgery. You've been approved for, we'll just say, bottom surgery. You've been approved for testosterone. Did you receive any of these procedures
The
for
one
medical?
thing, I did, I did meet with the surgeon for the top surgery, but I didn't actually go in, to the operating room. Um, Instead, I just first got the lower surgery, or phalloplasty, approved. I did go in for the testosterone, though. That one, the primary care physician asked me to come into her office and meet with her here in Davis in order to get the prescription. But she said, I could get it that same day at the pharmacy. So I went in. It was about maybe 10 or 11 minutes. And she just asked me, why do I want to be on testosterone? And I said, I'm hoping for a deeper voice and some facial hair. And then I asked her, you know, could you recommend another drug that maybe doesn't have some of these risks, like, liver cancer risks or heart disease risks, that could give me that same effect of having facial hair? Because that's all I really want, is the facial hair. And she looked so surprised that it wasn't that here I wasn't just coming in to get my testosterone, that I was asking if there's other drugs that could give me facial hair. Um, and then when I asked her about the liver cancer risks, she said, that she didn't have any studies that she could provide for me right then. I mean, she just looked so surprised that I would even question, were there other options, or were there any real risks. But she gave me the approval right then, and I walked over to the pharmacy, and when the pharmacist gave me my pump, again, I said to him, are you sure, I thought I read online, which I did, that this is off-label use of testosterone, and it's not really recommended for women or children. And he looked surprised, and he said, "But you're asking for this testosterone for gender affirming care." And I think what he knew, what I was trying to say, is that he's giving me something that he perfectly, knows well is very dangerous for me, but they do it because, it's gender affirming care, and therefore it doesn't matter if it's actually off-label and unsafe.
Wow. And did you end up using the testosterone?
I don't. I have it here. It was $5 copay. It's just a small little pump that I guess you squirt on your shoulder every. You have to put plastic gloves on, but I never used it. And I've heard that there's men in town, or men that would love to have this testosterone prescription because it's hard for men to get, but it's very easy for women to get if you say it's gender affirming, you know, care.
Oh my gosh. Okay. Wow.
Yeah.
So I wanted to talk just a little bit because my co-host raised this at the top of the hour when you and I were both getting
Right.
on the space. Some people, because obviously a lot of people are really impressed by what you did, but there are some people who are going to be critical and say, "Oh, well, she committed insurance fraud because she got testosterone she didn't need." But I think it's interesting because your story is I asserted I had an identity that was neither male nor female. It was non-binary. I felt this way, and I felt like I wanted to make my physical self match this identity, and then Kaiser provided testosterone, which I don't see how that would be fraudulent behavior on your part. And I just thought we could talk about that for just a minute because I've been surprised by that
Right.
criticism.
Right. Yeah, that's people have asked me, am I worried that this is, medical insurance fraud or some kind of fraud? And my feeling is I was truthful all the time with this idea of how I could feel as non-binary and asking questions about, how these surgeries might make me feel. So, I don't think I was necessarily lying. All of gender identities to me are pretending. If you watch your child pretend that they're male for several years, they're pretending to change their voice, or belching at the dinner table. It's kind of putting on a show. You're putting on a show, and so for me to do it with the doctors, I don't think that's any different than what the teenagers are doing. And if you go onto Kaiser's page, it has um sorry, on the Kaiser page it says, how would you define gender dysphoria? And that's just feeling anxious or stressed about your body. So to me, I never felt like I was saying anything that was untruthful, and I would welcome. I haven't heard one word from Kaiser since this happened. Nothing about my insurance coverage, no emails from my doctors or anything. But I would welcome, the opportunity to go in front of a courtroom and talk about who was actually guilty of medical fraud. My feeling is, Kaiser's guilty of medical fraud. They're telling uh, teenagers and young vulnerable people, or middle-aged vulnerable people, that these surgeries and drugs will uh, benefit them, and they won't. So um, I think they're very guilty of fraud here.
Well, and
Yeah.
the other thing I'll add is when you're talking about feeling anxious about your body, I'm about the same age you are. I don't know a woman our age who doesn't feel anxious about her body. This is a time when there's a lot going on.
That's very, very true. Yes. um, yeah, and same with being a teenager. I mean, there's so many reasons why we're uncomfortable with our body, that we all meet the definition, I think, at any point in a woman's life, of being, if you want to call it, gender dysphoric. Unhappy with either your hips, or you know your stretched out vagina, or I don't know what. But there's lots of things that not very comfortable.
So I'm going to jump in for a second because we knew we wanted to host a space with Beth, despite the hubbub about the WPATH files, and obviously we care about Beth's well-being, and if there was any concern about any kind of lawsuit, we definitely wanted to be apprised of that. And so I did talk to a couple of attorneys about this, and they kind of laughed. And what they said, first is that insurance fraud or any kind of fraud or medical malpractice, these are specialized legal areas, with very specific rules. And so you have these armchair attorneys on Twitter, making these ridiculous claims, but they know nothing about what they're claiming. And, um, one attorney said to me, well, if it's fraud, it basically means that Beth was getting services that she should not have been eligible for. And, let's see, it's maybe a couple hours on the phone with a clinician, let's say $300 an hour. And then I don't know how much, $60 for the testosterone or whatever it is. And they would send her a bill. That's how they would deal with that level of fraud. This isn't Medicare, Medicaid fraud. This is, and of course, it's not fraud because exactly the people who committed fraud was Kaiser. It wasn't Beth. So, yeah, I found it a fascinating discussion. In speaking with attorneys, I'd love to get more of that information out there. But yeah, so let's put that little problem to rest.
Okay, good. So,
Sorry, one more. I'm going to jump in with one more thing, which is that we've talked about, this idea that all of these services are available to you under the mantle of gender affirming care. And, how many women could go in and say, look, I identify as a woman. How many females identify as a woman and say, it would affirm my gender if I had, you know, um, a tummy tuck, or I had a facelift. I mean, I don't know how Kaiser would really combat an onslaught of women asking for this gender affirming care, but it would be a fascinating experiment in
yeah.
medical care.
Well, and even for the men that Beth was saying anecdotally she's heard about in Davis who would kill to get access to her testosterone pump.
Yeah,
If they wanted to affirm their identity as men, maybe they could get fast tracked for that,
right. Yeah.
you
Let's all
know?
be affirmed.
Yes, exactly. Okay, well, that's really interesting. We have lost Beth as a speaker. She's back in a listener mode because spaces are interesting. So, Ellie, I'm going to ask you to see if you can move Beth back into the speaker position.
Yes, we'll do.
And then we will talk about how her time undercover wrapped up, how it concluded for her, and how she decided to conclude and what's next. And now Beth is back as a speaker, which is great. So, Beth, let's talk about sort of how everything came to a conclusion for you with your undercover journey at Kaiser, and then what you're doing now and what's next for you.
I just wrapped it up with getting the approval for the phalloplasty, and I felt like at that point I had all the information I needed to at least prove to my teenager and my ex-husband and myself, and hopefully the world, that that there really is no safeguarding in place. It's all make believe kind of a medical scandal that's happening. um, so besides getting that message out, I've just been doing a lot of work as an activist, pushing back on our school system here in California, where they really, teach it and promote it and celebrate it. And so we have huge numbers of kids here in Davis who identify as transgender, and then also pushing back on sports. So I'm involved with a lawsuit with Alliance Defending Freedom, taking away our rights to speak about, protecting girls' sports. And then Harmeet Dillon Law has also represented me with a restraining order that the school district had on me. So I've been busy.
Okay. Wow, that's a lot going on. One thing that before we move to questions, and folks listening, if you would like to ask questions of Beth, go ahead and signal that you'd like to be a speaker, and my co-host will start moving people up on the stage. We'll have a lot of people who want to speak, so we'll try to move people through quickly, and we'll talk a little bit about that once we get to the question and answer portion. But Beth, one of the things that occurs to me as you're saying that, you were talking about kids in school, just going from your experience as one adult woman, the ease with which, not even the ease, the sort of sales pitch with which you were presented with all of these significant interventions could have happened to any 18-year-old girl, because she would be of majority.
Exactly. And that's just it, is it was so important for me to see what it's like as an adult, because these are still children. When your daughter hits the age of 18, we know they're still children. Even a young girl at 25, or some of these boys who believe they're um, in the wrong body. They're in their 30s, but so many of these kids or young adults, they're just quirky, and they're intellectually very mature, but socially very immature. Um, so this 18 is, to me, it's just such a scary idea that you wouldn't even have your parents involved with you making these decisions. And for my daughter in her health class here at Davis High School, they use the health connected curriculum, which is used throughout California. And I sat in on the class this last year with my son to see the slides that they showed my daughter. And they show, for what it means to be a trans man, they show slides of a woman who's had a mastectomy, who has facial hair, but who's about 9 months pregnant. So my daughter learned at school in her health class that she could take testosterone, have facial hair, have her breast removed, and still, you know, give birth. And so the kids, they're seeing these crazy ideas in their classrooms, in their science and their health classrooms, of what this gender medicine even means. So they're being sold, this idea in school, and I don't think parents realize that. And for me, when I said to my daughter, I know you've heard that you can still that trans men can still have be parents. But if you go on hormone blockers and puberty blockers, I'm sorry, and hormones, you might be infertile. And she said, well, that's no problem, because I want to adopt anyways, and so I don't need to breastfeed, I don't need to give birth. I'm just going to adopt a baby when I get older. And for a teenager, of course that makes sense, because they have no idea what it means to actually give birth, or to maybe decide to have a child. And so to just use a fertility bank, it seems like a really easy idea in the adoption route. And so that's the part too of this whole thing for a younger person, is Kaiser makes it sound like you're not really that a teenager could consent to these decisions, that no teenager could possibly know what they're giving up.
Yeah, even if it had been explained to them, the limits they're placing on their future life is so far away.
Right, right,
Their brain can't handle that.
right. And
I also,
IVF, yeah, to
yeah,
child, what does IVF mean? They have no way of understanding what any of this means.
no, they don't. And so, one last question from me, and then I'm going to ask some other folks to ask you questions, Beth. How has this affected your political outlook? Because you have talked about, historically you were liberal. You didn't have to be a conservative or a right-wing parent to be alarmed by the curriculum your daughter was being exposed to. How has this whole experience affected your political outlook and how you see the world that way?
Well, so that's correct. I've voted, I've been a Democrat my entire adult life. Um, I think it's made me really uh, question everything. And I don't want to say that, oh my god, I would always vote conservative now, because I'm sure there's lots of ways, Republicans also take advantage of getting people's votes. um y- so I don't know if maybe in this coming election, there's no way I could vote for Biden or Governor Newsom, given what they're promoting to kids, and the loss of girls, women's sports, and men in women's prisons. So so yeah, my political outlook, at least for now, is that, like many other Democratic women who are critical of this gender stuff, it would change my party in this case.
Yeah, that's really interesting because, within the context of Democrats for an Informed Approach to Gender, there are so many of us within the organization who really want to pull the party back to being the party of liberal values and free speech and open inquiry and scientific method. But there are a lot of women, particularly people generally, but women in particular, who feel politically homeless and like they don't have a home in the Democratic Party anymore and are wondering if it's worth even trying, which I completely understand.
Right.
Yeah. Okay. Well, is there anything else you want to add before we start talking to some other people and get an interaction going?
No, I think maybe I just want to thank Colin Wright for doing so much to kind of help me. He was one of the first people I started to really read, um, his writings about this, and he's also a UC Davis graduate. So he came to Davis a year ago, back in April of 2023, and spoke up about what's happening in our schools and the binary of sex and sort of as a biologist, it was so helpful for me to feel like I really understood the biology side of this. So just wanted to thank Colin and for publishing this in Reality's Last Stand. That was Thank
Oh,
you.
that's excellent. Because I don't know if you can see, Colin is on the space, so he's hearing you. That's great.
Oh, that's great.
Yeah. Well, Beth, thank you so much for telling your story and answering my questions. And now let's open it up to some speakers. I see that my co-host has moved one speaker on the stage, and we'll get the discussion going. I know that it's tiresome to hear this in every Twitter space you're in, but we got a lot of people who are going to want to ask Beth questions, so we're going to try to move people through relatively quickly. So to start with, I see that we have Jane Saylor has a hand up. Jane, welcome to the stage. And what would you like to ask Beth about?
I wanted to ask how whether she's organized with other mothers or how that's gone, because I get into these spaces, I hear the WPATH report, and then I'm all like, "This is it, the nails in the coffin. It's the end of it all." And then I don't know. It's really difficult to get people to get like they just don't know, and so I wondered if she's organize with other people to I don't know, get 50 people at one time who did exactly what she did. I don't know whether just kind of getting other people on board and how to organize and how to just really just start to drive this home and get people together. And
Yeah, I just really appreciate that, Jane, because I am involved with the parents group, Our Duty, and Protect Kids California. We're doing a lot with gathering signatures for the ballot measure. I'm also chair of the Moms for Liberty for Yolo County, and Moms for Liberty is doing amazing stuff with protecting parental rights in school. And then I'm involved with these turf groups, SF Turf and SAC Turf, which are also amazing women who are really speaking out. But I would love if anyone has any ideas of how we could, as parents, maybe push back on this medical side by doing lots of us doing these gender affirming care. So if there's any women out here that need a breast reduction or want to do a tummy tuck or have ideas for plastic surgery, I mean, why not go into Kaiser and tell them you're doing it for gender affirming care? I mean, it would be great if we could push back by just actually going, more people doing what I did in some kind of organized fashion. But
you definitely, I want to take up too much of it. I just want to I had a wild hair up my butt one day, and I was looking at an article. This is probably 2 years ago, and I called a gender clinic in Portland, Oregon, and I spun a yarn. I wish I'd recorded the damn thing, that I had a child that I didn't want the husband to know, and I was worried about the insurance, but I was worried about the mental health care, and surely that's going to be so expensive. Do I really need all of that? I was trying to, get information out of them, and it was just like I was on the phone with them. I wish I'd gone further and actually documented it, and I mean, because it proved to me, I spun a terrible story of an
right.
awful scenario of a parent pulling a child away from another parent and hiding something so ghastly. Anyway, thank you for doing this. Thank everybody for every little bit that gets done. Helps. So thank you.
Thanks so much, Jane, for your question. And I love the idea of an army of people, an army of women going in and requesting, quote, gender affirming care to show how ridiculous the system is. Okay, thanks so much. We have another person who's requested to speak. I hope I'm pronouncing this correctly. Dilio, would you like to ask Beth a question?
Yes, you got it perfect. And I'm a woman. I'm Allison in real life, but Dilio here right now. And
Hi, Allison. Nice to meet you. Welcome.
nice to meet you. And I have a bunch of accounts because I'm so happy to meet all of you all because we need to get together and start doing this. But my question for Beth, sorry, I'm just so excited. Um, is that when you said you didn't want to vote, you wanted to go to the evil side to me, like Darth Vader, to the right. Um, if we're caring about women, no matter what, we have to vote Democrat. We cannot. We have to vote against Trump. You know what I'm saying? Like
Do you
that
have a
man is
hey,
evil.
Dilio, Allison, thanks for
Oh,
sharing
it's
that.
not
Do
a
you have a
question.
question for Beth? Yeah, do you have a question for Beth?
No, 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 no. I was support because I didn't know what are we running like a show. Okay, cool. No questions, but I'm just saying all of y'all and for all the women here, um, we have to vote against Trump. I know Biden sucks, but whatever, because we're Democrats, right? This is DIAG Democrats. So I wanted to say that to Beth. So that's all. Thank you.
Thanks.
Thanks so much. Okay, we have another person who has requested to speak. And while we get her back up on the stage, Beth, I'll ask you, do you have any reaction to or thoughts about that? I mean, what does that make you think in the position you're in right now with the people you're working with?
As far as how I would vote or that
Not
that
as how you
question?
would, not as far as
Oh,
how you would vote, but the idea that there's a certain way you have to vote as a woman.
right. And I think, and that's where I think that part of me questioning this gender medicine and what it does it mean to protect women's spaces. I think for a lot of us, and we start to look at other things that are political and our feelings around them, and so it's I don't know. I probably don't want to get into these other topics. I try not to because of this fighting this gender ideology is so important to me and what's happening in the schools and medicine. But for me, if we have a president or elected officials who won't say a woman is somebody who's female with XX chromosomes, that anyone can be a woman, I just couldn't vote for them because if they can lie about something as basic as that, then I couldn't trust them at all.
Oh, thank you so much for saying what you think about that. I think that's helpful and it's a good part of an open discussion about where we are right now and where we want to go. Thank you. We have another person who has requested to speak, Ms. Ash. Ms. Ash, you may ask Beth a question and welcome.
Thank you. Can you hear me okay?
Yes.
Sorry, I do hear vehicles going by me. It's because I'm out jogging right now. So I apologize for the back noise. To the last person that was speaking, DeLillo, I think it was, saying something about the evil Darth Vader side of the conservative side. I laugh at that because honestly, I hate bringing politics into this subject because this is not something, I'm sure Buck will agree with me, this is not something that should be so politicalized, but it's become that because they just want to control it themselves for us to be more dependent on the government to begin with. Secondly, I hear so much of this going on all the time, but I kind of stepped out of the spotlight for a while because I'm honestly tired of it. What does anybody in here, besides you, Buck, because I know you know, but when do you think this starts for a child? Do you think that it starts as a child? And what do you think that has everybody just like come up with this because they think like it's a cool thing? Or do you think it's something that we deal with as a child and we suffer from it? Because I'm gonna tell you right now, like Buck, Blair, myself, this is not fun. Okay. But we still need that provided healthcare for us to get through this. And
Hey, Ms.
I don't
Ash,
think
thank you so much for sharing your thoughts. Do you have a question for Beth?
yeah, so Beth, yeah, that was my main question. when do you think? What's your outlook or your thought on when you think this starts? And do you think that there should be some kind of health care, at least still, for the people that have already gone through it after the age of 18? Then, of course.
So I guess my feeling is I grew up as a tomboy, had 3 older brothers, wore my brother's hand-me-downs. I rode a motocross bike, I played Legos. There was nothing about me that made me be what I guess we call a girl now. But this is the 70s and the 80s, and so nobody ever told me that I was doing being a girl wrong, right? I was just a tomboy, just a girl who liked all these kind of I just enjoyed being what I thought was a fun kid. So to be putting ideas into kids' head that you could be born in the wrong body because you're a boy who likes wearing dresses and princess stuff or makeup or um, all these sex stereotypes of what being a boy or girl means. And it's what they teach in the schools, right? That if your brain doesn't match your body because of your interests and your preferences, then you could be, you know, a different gender identity. Um, so I guess I just feel like there's no age that you should ever introduce gender identity to anybody at any point in time, and especially anybody who's going through some mental health issues with sadness or depression or anxiety. So I'm hoping that anyone who has done any medical transitioning, if they want to detransition, that Kaiser and all these other they should be provided all of this in the same kind of VIP treatment, all with minimal or zero copays, and they should be able to restore their body into healthy ways. And if people want to do these surgeries because they want to do these cosmetic surgeries, then it should not be provided as health care. It should be something you pay out of pocket like any other plastic surgery. And they need to be told that what they're doing is actually harming their body, that there's no affirmation, there's no care. These are plastic surgeries, cosmetic surgeries that serve no purpose and actually harm your body.
What part of that are you saying when you say plastic surgeries, which I understand, of course, but so after turning an adult, you think that nobody should have the plastic surgeries, correct?
No,
If
no,
I
no.
think
So
that's what
so
I'm gathering.
when my mom wanted to have her lymph nodes cut out because she thought they were cancerous, the oncologists and the plastic surgeons wouldn't operate on her. They did other treatments. She was put in a mental health treatment facility for a couple months, and she was able to actually overcome it. And it's been 30 years, and she's a healthy, active 87-year-old. So doctors weren't willing to give her surgeries that she didn't need for her body. So if you have an adult who wants to do some kind of surgery, woman who wants to have her breast removed, then you could do that, right? But you need to be clear you're having a healthy part of your body being amputated. You're not doing it to affirm a gender identity. You're doing it because you want a plastic surgery. I would hope that surgeons wouldn't even perform it. But if that's the case, then it should not be paid for by insurance and it should not be called gender affirming care. It shouldn't be any different than having, your hand cut off because you only want to identify as a one-handed person.
Well, I mean,
Thank you, Beth. And thank
that
you,
was
Ms. Ash. We're going to move on to another person
okay.
asking
All right,
questions now. Thank you so much.
Thank you, lovely.
So we have Jay Thomas with your hand up. I'd like to invite you to ask Beth a question.
Yes,
Hello and welcome.
I have two questions. First for Buck, how do you feel about sharing trans spaces with someone like Laura?
I'm sorry, I can't understand you. I think you may have a problem with your sound. Hello?
Hello.
We'll come back to Jay Thomas. I don't know what's going on with the sound there. The
Is it
next
true
person with their hand up is
that Mr. Buck,
Buck Angel.
Oh, hi everybody. Good evening. First off, thank you so much for having the space. I'm going to say this really quick because I don't want to take a lot of time here. But first off, Beth, I super appreciate what you're doing. It means a lot to me as an elder transsexual man, I understand where you're coming from, but I just want to say this to everybody in the room. I understand why you all are having issues with this because it was never like this before. We had a serious system in place so that these things would not happen. We did not transition children. We were against doing that, and I am very outspoken about that. I think you all know about that in this room. That being said, this is always going to be on the table. There will always be people with gender dysphoria. And so, what I just want to say this to you, Beth, I believe what you did is a service, okay? A service to the transsexual community. And I want to thank you very much for doing what you did. It means a lot to me. But I will also say that there will be adults forever in the world who will need this medicine. I'm 30 years, I'm 31 years transitioned, and I live a beautiful life, and it has been an amazing gift for me. But we didn't go on the internet and transition in 5 minutes. It took
Right.
me years upon years upon years of having psychological evaluations, of understanding what I was doing as an adult. And I think you all see me walking the world as somebody's thing is on or something. But I think you see me walking the world as a very healthy human being. And that's why I put myself out there because this is very rare. It is not what you see. These
I know, but
children,
Buck, I just want to say,
yeah,
how did you make the decision to give
yeah,
up 5 to 10 years of your life to take
yeah.
testosterone? I don't know
That's right.
how.
It's a great question. No, it's a great question. And
Right.
I'm very open to that 100% because I want to find a middle ground for us. I really do. No
Right.
children should ever do this, ever in a million years, ever should they do this. How did I do it? I was suffering. I'm 61.
Right.
And at 30, I had a bad drug problem, an alcohol problem. I was homeless. I was prostituting. I could go on and on and on. And it just was an opportunity for me to say, I lived as a butch woman for many years of my life, and that was fine, but it just didn't seem to be the right space for me. And until after years and years of psychological evaluations, I decided to make this choice. And I was the first person to do this here in Los Angeles. So again, on some level, I
Okay.
was an
I
experiment.
know.
And yeah,
I
yeah,
just want to say, because there could be young people listening to this, I
I
just
know
want to
that.
say that for anybody listening,
Yeah,
please don't ever do anything to your body to harm
yeah,
it. We
yeah,
have to, there has to be another way for a butch lesbian to
sure,
be happy. And
sure.
why can't we just change the dress, change the haircuts, but
But I did do that.
you don't
But
need to have facial hair to be male. You
I
don't need to
agree.
have a
I
flat
agree.
chest.
I
There's
agree.
so
I agree.
let's just change all of the medical part of this
I
and
agree.
say being transsexual could just mean changing your hair and your dress.
Well, the thing is, Beth, it's very rare. This is the problem. It is very rare what I have. It is not what you see
No,
today. And
I know,
this
but
is the
okay.
problem. This is the problem. I'm going to tell you right now, Beth, it's not going to go away. What we need to do is me and you need to come together
No,
and figure out.
but you're
Mhm.
telling people that they may commit suicide if they don't go ahead and go
No, I
forward with
do not
change.
say that. I
Okay.
would never say
Okay.
that.
Hey,
Okay.
Ever.
that's not fair. You can't
Ever.
say that about Buck right now.
I would
Buck
never
Okay,
would
I'm
say
sorry.
never
I
that.
do
don't know
that.
your whole story, Buck, but I
Yeah,
really don't want
never.
anybody to think that
Never.
that's the only
No, I fight
last
for the
option.
kids. Beth,
That
I fight for the kids not to do this. I
No,
don't want the
but
kids
fight
to
for
do this.
every single adult, every
Well, right now
single.
my focus is the kids because I have to have my focus
I
on
know,
one
but
thing.
if you have an
Yeah,
18-year-old daughter that is a
yeah,
child,
yeah.
and they can do all this, so
That's what
sorry.
I'm saying. I'm fighting for that. I'm a dad. I'm a parent, so I understand that. And
I
it's
know, but
I
yeah,
think there's
okay.
some
Hey,
misunderstanding here because authentic transsexuals are not
Well,
going to
it
do
doesn't
that.
matter. Beth, I do
okay.
appreciate everything you did. Thank you so much, my
Thanks.
friend. I'll reach
Okay.
out to you. Okay, thank you.
Okay.
Thank you. Bye.
thanks, you guys. Thanks. All right, let's move on. Good. To Cynthia, who has had her hand up next. Cynthia Cravens, who's a candidate for the Senate. Cynthia, what would you like to ask Beth?
Oh, hi. Yeah, this is Cynthia in San Francisco, and my campaign is pretty much over. It looks like I'm not going to be going beyond the primary, but I really enjoyed the process and very, very glad that I did that. Scott Wiener was the incumbent, and he was a formidable foe. but it was a good experience. I shouldn't be talking about myself. I just wanted to say hello to Beth, and I arrived late on this platform, on this showing, and I don't know if you've covered this already. Beth, did you already talk about the WPATH revelations by Mia Hughes and Michael Schellenberger, and as to whether, are you aware of those, and do you think that's going to affect Kaiser, or affect how you do what you've done in any way? It's just such an amazing revelation, especially within the context of what you did. I'm just wondering, what kind of thoughts you have on that.
Well, I welcome anything like this WPATH files and the people that are amplifying it all. I think those of us that have been around this for a while, we know that they're captured, that it's actually a trans activist group, WPATH, that there's not a lot of real science behind it, but I'm not, directly involved with the WPATH files, but just thank you to everyone who's doing that work. And it's just another part of this big puzzle to figure out how we got to this place.
Yeah.
It seems like quite a compliment to. It almost seems like the timing was serendipitous to you sharing your individual story, Beth, and then the WPATH files provides all of this context and evidence of it happening. It wasn't just your experience.
Correct. And, I just went back and looked at the letter my daughter wrote to me when she was 13, and those were her two resources. She said, "Mom, I know that puberty blockers and, testosterone will be safe because WPATH and Planned Parenthood told me it's safe." And she included the citations. And then, yeah. So, yeah. So, it goes back a long time, and they've had a huge impact on the curriculum in the schools. And what her pediatrician said the same thing. You have to look, actually it was an endocrinologist said to me that my daughter should be able to go on testosterone because WPATH says so. And so that's what he was referencing was WPATH. And when I said to him, well, what are the long-term studies? And he said, we don't have any long-term studies yet. And that's why I let my daughter go on birth control instead of testosterone. I said, if you don't want your period, I know that at least birth control, we've had women on it for 20, 30 years. I said, if you go on testosterone or period blockers, you will be the guinea pig. You will be the person who's being tested on. And so that was a kind of a compromise that I had. And so for people to throw out WPATH, back in 2018 for my child, it was, I'm just thankful that she wasn't medicalized.
Absolutely. Yeah. Well, thank you, Beth.
Thanks, Cynthia.
Just
Thanks
so
for
impressed.
everything you do.
Oh, well, you're terrific.
Thanks.
Thanks, Cynthia. Appreciate it. And next up, we have a question from Emmy.
Hi, good evening. Thank you so much. Beth, thank you so much for sharing your experiences this evening, both with your daughter and also with Kaiser, which is really eye-opening. And I hope your daughter is doing well. I also wanted to thank DIAG for hosting this space and being openly critical. Sorry, that's not me. I hope that where that background noise is coming from. Yeah, for being openly critical of the Democratic Party's handling of this issue, because Lord knows there's certainly enough to criticize. I was just wondering, though, regarding DIAG, what is your official position on protecting our spaces, women's spaces and sports? And do you agree with the statement that trans women are women, or do you have a different position? Thank you.
Oh, I don't know if Ellie or Ellen want to answer that. But let me try putting on mute. Maybe they could answer that.
Okay, yes, this is Ellen, and Ellie is here too. Emmy, can you repeat the question, please? I'm ashamed to admit I was dealing with a technical issue when you asked it.
Sure, absolutely. No, I was just saying that I really appreciate your organization coming about and being openly critical of the Democratic Party's handling of this issue, because there is plenty to criticize. And I say that as a lifelong liberal and a lifelong Democrat. But what I was wondering about your organization is, what is DIAG's position on protecting women's spaces and sports? And what is your position regarding, for example, the statement trans women are women, which we saw a lot of on International Women's Day on Friday? Thank you.
Thank you. I'm with you now on your question. So I understand why you're asking it. And I am going to talk about this both from my perspective and then what I know of DIAG as a volunteer. So my perspective is that in a liberal democracy, we are all entitled to our own opinions. And when you ask me about what do I think about men and women's spaces, men and women's sports, I think that's a bad idea. And when you ask me if I think trans women are women, I would say, for me as an individual, I'm not speaking for DIAG here, trans women are men who believe they're women. And I think that there are people who might disagree with me, and they might even be members of DIAG. And I'm open to having that discussion. But I think that one of the things that we've been missing in the Democratic Party is a willingness to have a discussion about that. When you talk about DIAG as an organization, we've been less concerned about language and more concerned about supporting reality. And in particular, we are very focused as an organization on the issue of evidence-based medical care for people rather than medical interventions based on beliefs or hunches. And Ellie, the co-host here tonight, is one of the co-founders. She's one of the founders of the organization, and I'm going to let her talk a little bit more about that.
Yeah, so, these are touchy questions. Obviously, we're a young organization. We don't really want to get dragged into the purity spiraling that's going on out there. Um, our focus is evidence-based medicine for all. Gender ideology is a very linguistic focused movement. And language, has been so twisted over the past 5 to 10 years. But unfortunately, it doesn't change reality. And, um, we know that you cannot change sex. Sex is a binary, and you can't change sex. And so language is, to a certain extent, a red herring, for what we're focused on. We're not interested in validating delusions. We don't see that as healthy or as kind. There's nothing kind about indulging in someone's delusions. We don't. I can tell you that we don't ask our volunteers how they feel about this, because we're not. That's not our issue. But if people may feel differently, but as an organization, our focus is about science, and about what's biological reality, and that extends to women's sports. We know the reality of women's sports, and we know the reality of women's spaces, and this may be unfortunate. People might disagree with it. People might be uncomfortable about it, but when you look at these issues, if you take it from statistical um, data on things like uh, the biological differences that affect sports, this is this is just another biological reality. We're not interested in taking the purity spiral bait about stuff. We're just dealing with biological reality. If the statistics show that males can outcompete females, then we need female only sports and spaces. Females are vulnerable not because of how they identify, but because of their biological reality. And we have to operate in reality. We just have to, as a society. So, I don't know if that answered your question, but that's who we are.
Thank you.
Emmy, thanks so much. Is there anything else you want to add before we move you off as a speaker?
No, I mean, I will say that's, I definitely have concerns about what I was asking about as well. Definitely about the children also. Lord knows if you saw today's New York Magazine article by that Andrea Long Chu person, but anyway, yeah, disappointed though, but thank you for answering honestly.
Thanks, Emmy. We appreciate you being here. Allie, you have your hand up. I'd like to turn the microphone over to you.
Yeah, thank you so much. I just want to take a second to praise Beth. I don't really have any questions for you, Beth, since I
Hi,
know you.
Allie.
I know you pretty well, but I'm just so grateful for everything you've sacrificed, and that you've been able to bring this out for everybody to see. And I'm also really grateful for the pushback that you just gave to Buck and the other confused man who was in this space. I totally agree. I think we need more people speaking out about this truly being a physical harm whenever our medical industry operates on deluded people. So thank you for that pushback. I'm a little disappointed that Buck ran away, actually, because I want to push back on her saying that she doesn't support medicalization for minors. She did up to just a couple years ago with an 8-year-old, apparently. So I just want everybody to be aware that groomers are really good at convincing people that they aren't grooming them. So I don't want to go off on too much of a tangent, but thank you for pushing back, Beth, and thank you so much for your bravery, and I'm just so glad you're my friend. I love you. I
I
love you
love
so
you
much.
too, Allie. Thank you. And I just have to say, Allie was the person who spoke out at a Davis school board meeting. And I had never heard anyone ever speak out on this issue in this very, very blue liberal town of Davis, a university town. And Allie was the person who made me kind of come out and just be public about my viewpoints. And, being public and saying what you really think and going in front of a school board or in front of, city council or uh, state capitol to the assembly, when you speak your truth, you feel so good about yourself. So if there's anybody on the fence about should they come out publicly and speak their truth, Allie just set the example for me, and I just want to encourage everyone else to do the same and to use true language. So thanks, Allie.
Thank you so much, Allie, for joining us. Okay, James DSD, you have the floor to ask Beth a question.
Oh, thank you, thank you, Beth, for your investigative story. That's quite a challenge.
James, I can't
Okay,
hear
can you hear me
you. Are
now?
you there?
I could hear him.
Okay, that's good. Thank you for your sharing your story. I just had one question. Who prescribed you the androgel?
The testosterone pump, the
Yes.
gel. You don't have to see an endocrinologist if you're over 18. So my primary care physician, and I later found out because I have connections in this small town that some of the other physicians at Kaiser here in Davis, they are not comfortable giving cross-sex hormones to their patients, and so they have a champion within this Davis clinic, a primary care physician who will take all the gender patients, and so she doesn't have an endocrinologist training, but she went ahead and prescribed testosterone for me, even though my levels of 15 ngdl, I guess, are very high for a woman. But when she showed me where I was in the range, she actually gave me the numbers for a male and said that I'm below the being what the diagnosis is, what the outcomes would be.
I see. So they just did a testosterone panel on you. They did not do a full panel.
Right. I just have my testosterone results. I have the test right here, and it just says my value was 15 ng DL, and it said the standard range, this is from Kaiser, is 240 to 700. It says for an individual who's on testosterone replacement or masculinizing therapy. So that's how they fake you out. They don't give you the range for a woman. They give it to you for somebody who's in masculinizing therapy.
Yeah, there's a whole bunch of other tests they have to do before even they would give me androgen, and I have an actual disorder. So
Uh-huh.
that's just junk. That's just junk science. It's like they have to measure your cholesterol level. They have to measure everything else because androgen is not it's a sex specific hormone, and it can kill you if there's certain things that are out of line in your endocrinology. And to not go see an endocrinologist or a urologist, those are the two people who are specialized in this field. That's not medicine. It's just quackery. So anyway, thank
Yeah.
you for your story.
Yeah.
Thanks so much, James. Appreciate it. Okay, we have another speaker, Kaylin. If you would like to ask Beth a question, welcome.
Hi Beth. You went in as a full grown adult to get this treatment. Where do you stand on bodily autonomy? Because acting like you're against adults getting medical treatment, and I would like to push back against DIAG, who said they're behind evidence-based approaches, despite the fact that evidence overwhelmingly supports trans people. Uh, where do you support or where do you lie on bodily autonomy if not for
Right.
adults like Buck Angel
Right. So
to be able to do
yes,
that
that's
stuff?
a good question, and a couple other people have asked me something similar. And I'm not, medical expert or medical ethics,
That's
but
obvious.
I would think that if we are going to be taking off healthy breasts of 18-year-olds, I think we should also be doing then surgeries that allow people to take their arm off or their leg off or to be
I
blinded.
don't think that's
I see them all as the same kind of surgery, right? It's a surgery,
but they're not.
but
They're not,
this
Beth.
is
Hey, Kaylin,
yeah,
let Beth
this is
Okay,
just
respond,
I'll let
my.
please.
Beth
Well, you
talk.
asked me what I thought about body autonomy. So what I would say is that doctors should follow the Hippocratic oath and do no harm. So anybody who has a medical license to practice medicine, a doctor or a nurse, they cannot do anything to a body that they know is actually going to cause some healthy impact. So it should be more like going in to get body piercings or tattoos, right? It should not be at a hospital or a medical clinic. um, Anything you're doing to modify your body in an unhealthy way needs to be done somewhere outside of medicine.
Thanks,
Okay,
Beth.
I
Okay,
would
Kaylin, would you like to
wait.
respond?
Oh, yes, I would. Thank you. I think having it in a medical field is very important for the safety of the patients. I think trying to push it out of those fields into back alley areas is going to end up doing a lot of harm,
Well,
Beth.
Kaylin, what age do you think a girl should be able to consent to a mastectomy? Like, what age do you think is appropriate?
Well, I think that it depends on what they want for their own body, because at the end of the day, it comes down to your own body.
So can a 12-year-old consent to top surgery, mastectomy?
No. Well, I mean, besides the fact that that is before breast growth is complete and it wouldn't be able to be done, I don't think that is a reasonable treatment. But we do have people that or kids that get breast reductions for back pain and everything like that, and we have no problem with that as a
Yeah.
society. So why is this a problem?
Yeah. Yeah. So you know, for somebody to have like a hysterectomy in the past, you couldn't have it done until you were in your late 30s or mid 30s, or you've already had children. I mean, we were not doing these kinds of
Uh,
elective surgeries until this whole gender affirming care came up in the last few years. And so, um, I just I don't believe that you have body autonomy because most people are having major mental health crisis. Either they have comorbidities of being, anorexic, or they're autistic, or they have OCD, or they have, some severe mental health issue. And that's why they want to go in and have their body modified, because they don't like who they are and they're not in their right mind. So I just disagree
Well,
that there's any kind of gender affirming care that should ever be done on any person at any time.
well, I'm gonna have to go ahead and disagree with the dissing on bodily autonomy because I think that is a very important thing for so many people. And I would also say, shoot, I forgot what I was gonna say. Okay,
Thank
but
you.
yeah, I mean, as long as you're clear about not liking bodily autonomy, we're clear there.
Okay. Thank you.
So
Thanks for your question,
yeah,
Caitlin.
I'm going to jump in on this because I think there's an aspect of this that has gotten lost, which is that, if you look at the WPATH files, what it shows is that, um, you know, these these interventions do cause harm. They cause harm, and you know, is it medically ethical to provide a treatment that causes harm when, I know, Kaylin, you said that medical evidence is overwhelmingly in favor of these interventions, but for people who are kind of on the wonkier side of this, who look at these studies, the problem is that the medical evidence, the data, is actually not there. If you look at the studies, they're just
I've read a lot of
sorry,
the
hold on, let me
studies.
finish for a second.
Sorry, go
Um,
ahead.
yeah, there's lots of studies, and the studies say certain things, but you have to look very carefully at things like bias and loss to follow up and confounding. And there is tremendous nuance. It's not just these people were happy, or it doesn't show regret. That's not enough. That's not actually evidence in the way that any other medical procedure that is this um, life changing and this irreversible and does this much, increases risks to health to the level that this does. And you do have a patient population that typically presents with comorbidity. So the question of medical ethics, yes, bodily autonomy is raised as a major issue in this, but there has to be medical ethics. We have to have an ethical approach to medicine that accounts for the cost, risk, benefit for harm. So if you look at that, this is why the demand for really well crafted studies with valid methodologies, where you don't have 20% of your participants dropping off. That's a major problem with a study. Or if you introduce bias in any other ways. And actually, if you go to the DIAG website, we have a section on studies where we look, and we have a research team who analyzes studies. They look for that. We have a section that explains bias and the other issues around how to understand a study. So we go through, we look at these studies, we provide summaries of the studies and what the claims are, and then we bring up what these problems are with these studies. And I would welcome you and urge you to take a look at our website and look at the studies and see, maybe those are studies that you think were, great studies because they show, what you want them to say. But the reality is that we do not have data. And as the party of science, we really want data because we don't want to be harming people. We should not be giving a person who cannot understand the long-term consequences of a treatment that is going to increase their risk of stroke. We cannot be having people sign off on a treatment if they don't understand what risk of stroke means, increased risk of stroke or increased risk of thrombosis. These are serious consequences. And if you ask an 18-year-old or a 20-year-old or even a 25-year-old or, some of these very vulnerable people, if it's worth it to them, of course they're going to say yes, because they haven't experienced life, after a stroke, you know, or any
Well,
of these other things. So I'll stop talking in a second. But anyways, it is consent and the ability to really comprehend those costs without knowing what those costs are. We don't have valid, well studied research on what those long-term costs are. So do we experiment on people in the meantime because they want these treatments? I don't think that that's ethical.
Well, okay, the one thing that I would say is that the thing you're missing with do no harm is not doing anything is also a harm. Denying care is also a harm. And the thing is, in this group, this is only cis women talking for the most part. You had one trans man talking who agreed with you on most parts, and you immediately shut him down because you can't listen to the people who are receiving the care.
Well, yeah, I'm sorry if you felt like we were shutting people down. I think we did want to move and get as many people on here as possible. I think we haven't. There's nobody that's asked to speak that we have denied a chance. So I want to be clear that even in our launch space, there were people who came on and disagreed with us, and
No, I
yeah,
didn't.
we're going to let them on. But when you say doing nothing is also harmful, that assumes that we're going to be
But
doing nothing, and I don't think that that's the case. I think that as Buck Angel said herself, this was a long process of exploratory therapy. There were a lot of hoops to jump through to make sure that somebody could really consent to these. And I think what, especially with our current cohort, that without in Beth's case, there was no gatekeeping whatsoever, none. And to approach these treatments without any sort of exploratory approach to figure out what's going on, why is this desirable when the costs are so high and irreversible. So I know we're not going to agree on that, and again, I'm glad that you're here speaking, and I welcome your opinion. So I'll let you weigh in, and then we'll move on to another speaker.
can I say one last
Yeah.
thing? Okay, sorry. Yeah, I had a similar experience to Buck with it. I was put on antidepressants at 12 years old. I was severely depressed all through high school. I ended up dropping out of college because of that. It was only after I was able to receive care that I was able to do anything with my life. And I think putting barriers in people's way, I think the reason Beth was able to get through is because she is a full grown adult who is able to weigh those decisions. I was. I had a much longer process doing it at 20 years old, and you know, it didn't help me. It caused me to lose a lot of my life. And I just felt that needed to be said because I think Beth is infantilizing a lot of the choices that we make for our own health. So thank you.
Thanks for joining us, Caitlin, and thanks for engaging. Appreciate it. We're going to move on now to Learned Mama, who we haven't heard from. Do you have a question for Beth, Learned Mama?
I do have a question for Beth. I am wondering if any left-leaning media or liberal media outlets have contacted you, or if you have people that have reached out to people, say like Rachel Maddow or MSNBC or CNN or any place like that, to talk about your experience.
At this point, as I expected, I've been contacted by several, more right-leaning news outlets, and there's some stories coming out. There's actually a big story coming out on both my daughter's perspective and my perspective that is mainstream media that I'm really excited about. Like, I don't want to say what outlet it is yet, but I think there's a lot more interest in this story, and I'm hoping that mainstream media. I've spoken to reporters at Reuters. They did a really great story on all the gender affirming care about a year ago, Robin Respalt. And I also spoke with The Economist, and they've done some good stories. And New York Times, hit or miss. I'm hoping, my undercover work could be picked up by mainstream media. I think people want to hear about stories like this, and it's if you're new to this whole area of medicine, it's easy to imagine you as yourself as a parent doing something like this, right? So I'm hoping the story will get picked up, but right now it'll be coming out in a few big outlets in the coming weeks. But your more typical, conservative news outlets.
Yeah, I think that's part of the problem is the Democrats not stepping in to own perhaps how they've spread misinformation about what is ethical medicine in the euphemistic term of gender affirming care.
Right. All right. I'm actually hopeful that maybe if Kaiser did want to try to, say that I should be charged with medical fraud, that could become a story that the mainstream media might pick up, right? That I've been committing medical fraud, and then if they covered it, people would say, "Wait a second, she's just trying to protect her child and other, kids that are getting caught up in this." Um, and that's why I think Kaiser's being so quiet. I think they know that it would be a bigger story if they did try to press charges or do anything legal.
Well, that almost seems like a reversal in the sense that perhaps they're committing medical fraud by
Right.
overly endorsing and not providing adequate mental health interventions to people who feel dissociative from their bodies.
Yes. And I think Kaiser too, they had a 11-week strike back in fall of 2022 where all the mental health therapists, they went on strike because they're overbooked. They only get, 20 or 30 minutes with a patient. They don't think, they're not compensated adequately. And so Kaiser is known as having some of the worst mental health treatment available for the patients. And so it's so much easier to just tell somebody who's depressed and having mental health issues, well, we'll just give you some drugs and we'll give you a surgery, and you'll be happy and on your way out the door. And so for Kaiser, I see giving testosterone being such an easier treatment for them than rather than providing real mental health, treatments. And Kaiser's notorious for this, and that's why I always paid out of pocket for my own child or children to see, any kind of mental health experts. Is This is partly the problem with Kaiser, right? They don't want to give you true mental health service. They'd rather just give you a Band-Aid, or in this case, a testosterone pump and a surgery.
Right, and it stands to reason that you would feel mistrustful of a medical establishment that doesn't believe that sex is binary or that we don't have biological reality to contend with, and that there's this magical idea of gender identity, which is really just in your mind, not
Right.
correlated to your biological sex. So how can you trust them to be a good guide in that regard?
Excellent. Yep.
Yep. Thanks so much, Learned Mama. Appreciate you being here. It is almost the end of the second hour, so I think it's probably, and we've heard from almost everybody. If you asked to speak and we weren't able to get you on stage, I'm sorry. We had a lot of people requesting to speak. Beth, thank you so much for coming and telling your story and being willing to respond to questions and engage. We had a real discussion rather than a staged one. Oh, we have one more person that has already been promoted to speaker. Sorry, I missed that. This is the thing of co-hosting. Gigi LaRue, we'll have you as our last questioner, and then we'll wrap up.
Hi, I just wanted to say thank you to Beth. This is sort of part of the process of eliminating this really shoddy healthcare from the public sphere. And I wanted to backtrack about Kaiser. I have talked to several doctors that work there, and surgery is the only department where they were told, you don't need to vet these clients. We got this. And so they're not being vetted properly. As we know, in California and all over the country, you can get surgery letters in an hour. And so the surgeons are not being allowed to protect themselves. And so I think we need to really empower them by sending every single surgeon the WPATH files, because I think once you know, you can't unknow, and they need to stand up and they need to start requesting the right to vet their own clients, because I think a lot of them are unaware and they're waiting for somebody else to do it for them, and they're going to end up getting sued. And I think it's just going to really mess up our healthcare system. So I think, a lot of these people are really thinking, they say things like, oh, but they're so happy when they're done, but they don't really understand the long-term effects of this. So it's up to us to really educate them. So I really appreciate you showing exactly what it looks like to do this as a mid-50s woman, because I can imagine it's even easier when you're 20, because there's no safeguards. So I just really appreciate you guys having this conversation and having a space to talk about this. And let's keep going.
Sounds great.
Thanks, Gigi. And if I can just build on what you said, we actually have on the DIAG website, which is di-ag.org, under the Take Action header, we have letter templates so that you can send the WPATH files information to gender clinics. And so if anyone on the space
No
is
one's
thinking
speaking.
about what they might like to do after this, that's a good action to take. So if you go to the DIAG website and look under Take Action, it has a letter template talking about the WPATH files, the WPATH statements that you can use, and then a suggestion on how to approach gender clinicians on this very topic. Ellie, are we about ready to wrap up, do you think?
Yeah.
Now that we're at the top of the next hour?
We're ready to wrap up. I think it was certainly a lively discussion, and we're liberals. We believe in having these discussions rather than shutting conversation down, no matter who wants to speak. And so we'll continue to do that. And this is the opportunity to discuss this, a topic that's been pretty much shuttered for years. So that's what we're here for.
That's great. Well, thank you so much, Beth.
Oh, thank you.
Like I said earlier, being here. Such a good story.
Oh, that's great. Thank you so much for all that you guys are doing too with DIAG.
Thank you. Okay, Ellie, are we going to
Yep,
end this?
let's end it. Thanks for joining,
Thanks,
everybody.
everybody.
Bye-bye.
Bye. Good night.